Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I'm your host, Kurt Barwis, the president and CEO of Bristol Health. Today we have a really exciting guest for you, Nirva Modi. Nirva Modi is a pharmacist at a pharmacist PharmD at Bristol Health in our retail pharmacy. Nirva, welcome to our show this morning.
Hi, thank you for having me here.
So tell us about yourself.
Hey, so my name is Nirva Modi. I am the pharmacist in charge at Bristol Health, and I've been with Bristol Health since 2020, and I was part of a team that actually opened the pharmacy, so this is pretty near and dear to me.
Wow. So 2020, that would have been the beginning of the pandemic too.
Yes.
It came at a really challenging time. And the pharmacy you're talking about is a retail pharmacy, right? So people can come off the street and use that pharmacy?
Yes, anyone can use the pharmacy, just like a Walgreens or CVS. We also cater to all our patients and employees as well that are at the hospital.
And it's pretty convenient, right? I mean, it's like right at the front door.
Yes.
So you can just pull up, jump out, get your prescription.
Yeah, we're located right at the main entrance. You come in and there's a gift shop, and we're located inside the gift shop.
Inside the gift shop. So that's pretty good. And you can actually go around the corner and get coffee if you want to from Ivy's Brew. Yeah. Anyway, so you've done pharmacy for how many years now? How long have you been at PharmD?
I have been at PharmD since 2015. So
it's a pretty daunting thing to do, right? To go through pharmacy school, and then it's a PhD in pharmacy, right?
Yes. Yes. Now you have to get a PhD as a pharmacist.
How many years does that all take?
It's about a 6 years program. 6
years. So that includes undergrad?
Yes, it does.
So including undergrad. So what made you do that? What made you be a pharmacist?
Well, I went through my undergrad as a biology major, and then I was thinking, but realized I was already working in a pharmacy, which I liked. So I'm like, why not be a pharmacist? So then I applied for pharmacy school and got in.
Not an easy thing, right?
No, it's definitely not.
Yeah. So you came, you said earlier that you came out of Georgia, right?
Yes.
And you moved up here into Connecticut. So what do you think about the climate difference?
Definitely change.
Not cold. Although it seems to be getting warmer up here, but
yes, it's definitely like past year we didn't have much snow at all.
No,
so it seemed like Georgia weather to me.
A lot of wet water now too. So let's talk a little bit about pharmacy. So people that come in, let's start with one thing. The real driving force behind the hospital building that pharmacy had a lot to do with the patients that were in the hospital. So they have this, what they call meds to beds program for patients that are being discharged, right? Talk a little bit about that.
So meds to beds, a program where we deliver meds up to the patient's room when they're about to be discharged. This helps patients because they don't have to stop by at CVS or Walgreens or any other pharmacy on their way. They have their medications when they're discharged. So it's just a convenience factor. And why not?
Yeah.
since we are already there, get their medications, and then they get to go home and rest.
Yeah, it's from an outcomes or a quality standpoint too, medication compliance. We know from the data that medication compliance is very much improved.
Yes.
When the medications are there when the patient leaves the hospital, because they may have difficulty getting to the pharmacy. There may be prior authorizations that are required and things like that, which all can be worked out before they leave the hospital. So medication compliance means that as a hospital administrator, that the chance of them being readmitted to the hospital or coming back to the hospital is decreased, and that's a quality indicator for us. That's something that across this country, all hospitals look at is, we want to make sure that we solve the patient's problem for whatever episode of care is, and then when they go home, they have all the things they need to sustain their health, the health that they achieved when they left the hospital, and not have to come back again. So very important. So now that program is expanding to other areas, right? It's expanding to the ER and other areas.
We have recently, we started with our, the G floors. Then we're expanding it to, right now, currently expanded it to ER and peri-op as well. So, and in future, I'm sure we're going to be expanded to first, families are first.
Yeah.
And the SBHU.
So a lot of acronyms there. So G is a med surgical floor. Right. And then peri-op is our surgery center. So if you come in and you have a surgery, whether it's ambulatory outpatient surgery or inpatient surgery, same program applies. You can get your medications so when you leave, you've got everything you need when you go home. So the idea of making it convenient and making it high quality was really the driving force behind that. So then the other part of that is, people are used to driving down the street, going to their local pharmacy, but they could do the same at Bristol Health, right? They can get their medications delivered to their home even, right?
Yes, we offer service, free delivery service as well. So, and it's a same day service.
So free deliveries.
Yes, it's free deliveries for any patients who would like it. So
tell me, what's the advantage
of the free delivery?
No, of coming to get you to fill their prescriptions versus somebody else out in the community?
Well, so our pharmacy, we have a dedicated and caring staff. So, and we have a lot of years of experience. So some of the things we offer as it's definitely a free delivery service, and we offer like the special personalized attention to patients as well. Some of the service that helps them is that personalized patient assistant copay, where what we do is actually look up copays for help. Like say if the patient has a high copay on a prescription, then we actually help them by seeing if there's any other copay assistant program out there and help to decrease that copay. So
that's awesome.
Yeah.
So somebody that's struggling financially.
Right.
So in the background, we have the financial people. You can actually look to see if there's an assistance program to help them, or any kind of program to help them with their medications. I mean, I always kind of felt like it's part of the Bristol Health family. So if you're going to a Bristol Health physician, you guys can just call them up directly and ask them questions about the medication, those kind of things. So when somebody orders a prescription, you guys do a lot of things. You don't just fill that prescription, right? You look at a lot of different variables. You look at what else the patient's taking.
Yes.
So talk a little bit about that. What, from a pharmacist standpoint, how do you ensure, I would kind of categorize it under patient safety, that a patient's safe?
Yes. So when we get the prescription, the first thing we look for is this medication correct for the patient, the dosage, if they're taking any medications, or is it interacting with any other medications they're taking? Are they allergic to anything? We look at all those factors. We fill through prescriptions. Then there's also the fact where let's say if they are allergic to that kind of medication, or if they have any interactions with their one of the prescriptions that have been prescribed, we can reach the doctor right away through our text messaging system that we have at Bristol Health, and reach the doctor, and we get it switched over to whatever is preferred.
Whatever's preferred. That's awesome. So you guys are really working in the background to make sure it's safe.
Yes.
And then you have patients that have, they go to their cardiologist and get a prescription. They go to their pulmonologist and get a different prescription for a different condition. They go to their primary care physician, who gives them another prescription. Some patients have as many as 12, 15 prescriptions.
Yes.
And so the idea, or that safety check of drug to drug interactions, allergic interactions, things like that is vitally important, because not every physician knows the stuff that you all know, right? You know how these things interact with each other, so you can raise the red flag. That's pretty good. So in terms of what the viewing audience might want to know about, I always my wife gives me a hard time, if I get a cold or something happens, I'm like, I have a prescription up in the closet, or have the cough medicine, the Finnegan or whatever it was from 4 years ago, which is clearly expired. So is that a problem? I mean, I want to be careful with it. Yes, you're not supposed to take expired medication, but is the effectiveness, what can go wrong if you take medications that are expired?
Well, first of all, yes, you shouldn't be taking medications that are expired or that have been with you a while. It does decrease the efficacy, and there could have been some kind of chemical thing that could have happened, but could have either crystallized, something that could have changed in the medications. That let's say if it's been sitting in the heat too long, or if it's some people like to store it in the bathroom, and I mean that's probably not a good idea. Humidity, that could definitely decrease the efficacy, and it could react into your body. Within the last 4 years, like you're saying, if it's sitting in your house, you could have.
I'm not saying I do that. I'm just saying, for example, right?
But if it's been sitting there and you take it, there could have been changes in your health within the last 4 years as well. So you shouldn't be taking something that's left over, obviously, in your home.
So it could be really dangerous for you. So It may have been okay 4 years ago.
Yes.
But if you didn't go and get checked out, and you might have a different condition, now all of a sudden you take it, think you're going to get the same response, but it could be, that's kind of interesting, crystallized or changed in composition, effectiveness, but you yourself can change. So it can be very harmful to take expired medications. So you should never do that.
No.
Okay,
Definitely.
all right, good. We got that right. And then another thing that always makes people kind of wonder is disposing of medications that are expired. So people go in, they have an outpatient surgery or a surgery, they get discharged from the hospital, they have some very powerful drugs that they bring home. I always worry about, misuse of those drugs, right? So you have people over your house, you don't know, they go into your bathroom, into your cabinet, they see something that's like a narcotic, they may have kids, whatever. So not good to keep those drugs around your house.
No.
So how do you get rid of them?
So a few different options, where Bristol actually burns their trash. So it is safe to throw them in the trash. If you don't prefer to throw them in the trash, there's police stations. They have, in the back of the police stations, they have a where you can discard all the expired or unused medications that you don't want. Also, the third option would be, there is every year some of the pharmacies, they have DEA take back programs where that you can take all those medications and you can dispose all your unused medications.
So never put it into the toilet in the bathroom.
No, definitely not.
Because somebody was saying to me that, with the number of people that are taking statins for blood, for cholesterol, that we're all taking it because it's in the water supply. That can't possibly be true, right?
That's probably not true, but I'm pretty sure there's other things that are affected if you throw it in the trash.
Yeah.
Other organisms that are in the lake water that are affected. But just to for the safety purpose.
So proper disposal is critical, especially for somebody who's gone through a very serious health episode and has some very powerful medications. So they can turn them in. There's usually a drop box around the police station. They can put them in the truck. They could take them back to their own pharmacy, right?
No, actually, they cannot.
No, they can't take it back to the pharmacy. Okay, I just figured to ask that question. But think about, they should properly look up and get rid of these medications.
Yes.
So what do you see, as the pharmacy program grows at Bristol Health? What's the next piece of that? Because when we started, it was very slow. Now it's getting busier and busier, and we're expanding. We're expanding into specialty pharmacy and some other areas. How do you see the future for us?
It's definitely good.
It's good. That's a good thing to tell me that it's good. I want to hear that. That's very good.
We are expanding into specialty medications, which they are very hard to get at certain points. A lot of patients I've heard is complaining because they're getting deliveries late, or there's a lot of back order issues currently that are going on, which means manufacturers are not producing enough medications, or there's some issues going on with the medications where there's not we're not getting supplies as much. And I'm guessing us being in hospital pharmacy, there is a little benefit, I feel like, where we're able to keep medications in stock enough, even specialty medications. So far, we've been able to supply those medications for the patients that need them, and they've been very happy with that, because they have found that very hard to get somewhere else as well. So
yeah, it's interesting you talked about the supply shortage, because that's gained federal attention, state attention. There's been investigative hearings on it. And then the other day I heard Dr. Caminiti talk about one of the other complications is that, some of the drugs that we give in the hospital, which are not oral drugs, right, are IV related drugs. And, but part of the criteria for somebody to meet inpatient standard in the hospital is that they have to be getting some kind of a drug that isn't an oral drug. But when there's a shortage and you switch to the oral drugs, all of a sudden the insurance companies say, "Oh, you're not. You should be an outpatient, but you're in the hospital not just because of the medication. You're critically ill." How much of the authorization process is that, from a retail pharmacy standpoint? Is that a big deal? I know I'm going through it right now with my cholesterol medication. It really seems hard and difficult for people in the community. The medication I was on, all of a sudden now, is no longer on my insurance plan's formulary, so it interrupts my dosage. So they have a new medication approved effective July 1, but you run out before July 1, and then you have to go through a whole new prior authorization after July 1, which means you're not going to probably get your medication for 4 to 6 weeks. Yes. And then I hear that, and I know this is true, that they use a lot of these computer programs, artificial intelligence to screen these things, and there's a lot of denials. So you deal with denials all the time.
Yes. So, I mean, since we're talking about yours, let's say like I went through the prior authorization process, and obviously I got a denial because they have certain criteria that you have to meet, which is like, did you try this preferred medication before you were switching over to this medication? Or are you of certain age? And if you don't meet any of those criteria, that's an automatic denial. Once we get the denial, we have to contact the doctor for an appeal. The doctor has to go through an appeal process, which takes a long time, and it's a very lengthy process.
I got a text immediately from Dr. Kasi. It's like, this is a computer denial, and I'm spending more and more of my time on these things. So you don't have to do the physician, whoever the physician is who's requesting the drug has to do it. And I think the hard part, which I'm now experiencing, right, is that I went through all the prior authorization process. Right. I was actually authorized for the medication under a different manufacturer, but they essentially do the exact same thing. But now we got to go through another prior authorization to get that medication.
Yes, which is kind of frustrating because the insurance is the one that wanted you to switch over to a different manufacturer.
I'm doing it for their convenience, right?
Right. And now they're the one who's saying, no, you got to try the first one for you to be approved for the second one, which doesn't make sense.
And the other part that's very frustrating to me is we want cardiologists, we want physicians to be taking care of patients, right? We want them to treat patients. And there are shortages of many specialties of physicians, yet we have these hurdles and hurdles and hurdles that are taking more and more of the time and taking physicians away from what they really need to be doing. And it makes it harder for patients to get appointments with them, right?
Yes.
Hopefully
because
soon
they're
that's
spending a lot more time doing these authorizations for every specialty med, I feel like, rather than helping the patients.
Yeah, I totally agree with you. And like I said, I'm living through it. And anyway, so in terms of like what, as a pharmacist, what would you want to tell the community? Like things like those pearls, those really exciting, important things that they need to know to stay safe with medications.
To stay safe with medications is just one of the major things that you mentioned was it's definitely don't use anything that's been sitting in your closet for a long time.
Can't say I don't ever do that, but yeah.
Yes. Second, I would say just look at what you're taking. If you feel like anything that's unusual when you're taking the medication, please don't hesitate to contact the pharmacy, any pharmacy or your doctor. Just let them know what you're experiencing. And that should help you at least. If you feel like, if you didn't realize that you were allergic to medication and all of a sudden you have an allergy, like you're itching or you have hives, stop taking the medication, call your pharmacy or the doctor immediately.
Yeah, that's really great advice. I think the other thing that I would add to that is some people don't realize they're slow metabolizers, and so a normal dosage can be twice the dose for them. It depends on how their body metabolizes it. So that's important advice. Call if you don't feel right or something doesn't feel like you feel like it's not working or you're having a reaction. Absolutely call your doctor. So thank you for joining us today for this episode of Bristol Health Cares. You can always write us at cares@bristolhospital.org with your questions and concerns. A special thanks to Nutmeg TV for producing this. They do a wonderful job for this community. They really, really do deserve and need your support. You can just link to them on their website. And then just finally to say to you, to reach the Bristol Hospital Pharmacy at any time, the retail pharmacy, it's 1-860-506-0675. Again, that's 860-506-0675. Thank you for joining us for this episode of Bristol Health Cares, and I look forward to seeing you the next time.
When we think of an iconic New England town green, we think of the place where people got together and maybe heard some music, heard someone give a speech, maybe get an award. Times have changed, but the digital town green still brings all those stories, all those voices back to a central location. Nutmeg TV has been providing community television for over 30 years. We provide great facilities and training and equipment to allow anyone to come in and produce TV programming for the community.
Whether you're a college student looking to get into this industry or a senior citizen looking to learn a new skill set, we've made our equipment accessible to anybody.
Nutmeg TV is a family, and we embrace diversity, and we work with folks from all walks of life. And it's our job to make these studios available for anyone to use. We educate folks in how to do TV production, podcasting, etc., and so they can go on to other careers in the TV business. Nutmeg TV is really blessed to have a great group of folks who work here. We have a culture at Nutmeg TV that is set from the moment you walk in the door for positivity all day long. Each and every day, we are affecting the community in which we live. We needed some studio upgrades, and we were able to get a grant with the state of Connecticut, but we needed that extra bit of cash in order to get over the hump. As you know, technology is very costly, and we needed to do that. And Ion Bank believed in us. They believed in us, they believed in the project. They came down, they took a look at what we needed, and they said, you know what, we can help get you the rest of the way. As a result of Ion Bank's financial help, we've been able to help others move on in a field that's difficult to get experience in. It's very important when you're a business that works in the community and for the community that you're working with partners who understand who you are. And Ion Bank does that. They walk with us every day. Community is important, and Ion gets community, and they get Nutmeg TV. It's community banking at its best.